Henry Ford West Bloomfield Hospital will be hosting a free, open to the public heart screening event on Saturday, April 18th. A free community-focused health initiative designed to promote early detection and prevention of cardiovascular disease through accessible screenings. It's going to be hosted at multiple locations across Southeast Michigan, including Henry Ford West Bloomfield Hospital, who is hosting for the first time, bringing vital care directly into local communities. Joining us now on the Splash Live to tell us more is cardiologist Dr. Shalini Modi with the Henry Ford West Bloomfield Hospital. Shalini, thank you for joining us.
Good morning to you and your viewers.
Of course, glad to have you on. Really important information to be getting out there for the public. What is the overall mission behind the Healthy Heart Screening event, and how has this event evolved over the years?
So, three core messages from our entire conversation will be awareness, early action, and better outcomes. So the mission in totality is about creating early awareness for detection of heart disease, prevention of heart disease in our community. It is also to connect our community members with medical resources available at Henry Ford West Bloomfield should the need ever arise for such medical services. So the ultimate goal, if I were to put it all together, I would say it is to decrease the incidence of heart disease, improve public health, and empower individuals to take an active role in their own health.
That's great, and that's important information for everybody to be aware of when they stop by to this heart screening event. How do these screenings differ from a typical doctor's visit, would you say?
It's an excellent question. So usually screenings, when they happen, they are meant to be at a larger scale. That's meant for the community. So they're really broad-based items. Certain fundamental tests are done, and they're very quick and focused. There is no prescription, there's no diagnosis, there's no physical exam. Differ that to a visit with a nurse practitioner in cardiology versus or a physician in a cardiology clinic. There will be that visit is more curated to the needs of that individual, be it testing, be it the exam, whatever is needed to make the diagnosis, as well as prescriptions are a part of that.
Of course, it seems like you've got really tailor-made resources available for every individual person that stops by. And it sounds like there's a lot of different types of tests that are going to be offered with this program. Can you walk us through the different types of tests that there are and what each one reveals about heart health?
So the whole process is meant to be very simple, organized, and focused on quick assessment. So when a community member walks into the building, there's a check-in process, they fill in a questionnaire, and after that, they will be taken into a room. They will be vital signs, which include heart rate, blood pressure, followed by a blood test, which is to check a spot blood glucose, followed by an EKG. All of the questionnaire and all the results of these are taken to the consultant, where they sit down one-on-one. There will be one of our nurse practitioners or a cardiologist present at the moment. They get to discuss that. Then they will be provided with educational resources, or even if a referral information is required for a primary care physician or a specialist, all of that will be given at that moment.
A lot of valuable information that you're getting the same day as you take these tests. How valuable is it for patients to receive same-day results and speak directly with a physician?
Wonderful point. So the advantages, it's being done, like I said, these are focused and quick assessments, but nevertheless very valuable, because I believe it takes a motivated individual to walk up to such a screening event and go through that process, and to be rewarded to sit down with somebody who can review all these results and give them one-on-one feedback. And hopefully, at the end of the visit, they walk away with a peace of mind and motivated to make changes for their health.
All great things for people to take away. For those just joining us on the Splash Live, I'm talking with Dr. Shalini Modi with Henry Ford West Bloomfield Hospital, cardiologist with Henry Ford West Bloomfield Hospital, about a heart screening event. It's free, it's open to the public, and it is taking place on Saturday, April 18th with Henry Ford West Bloomfield Hospital. Now, Dr. Modi, why is now such a critical time to focus on heart health and preventive screenings?
I think everybody worries about cancer, but let's not forget this very important fact that nationally and internationally, heart disease happens to be the #1 killer. So awareness is the key. To know what all leads to it, it's the risk factors. The risk factors are on the rise, especially after the pandemic, right? Lifestyle changes. We're talking what leads to heart disease. There are things that individuals can do. We're talking about walking around with high blood pressure, not even knowing about it. Each 5 millimeter point decrease in blood pressure control can lead to anywhere from 10 to 25% improvement in overall mortality, which we're talking about heart attack, we're talking about stroke, we're talking about heart failure. And if one doesn't get their blood pressure checked, how will they even know they're walking around with this? Diabetes, the stress. In fact, there are even environmental conditions that lead to increase in heart disease. So if that awareness is not there, individual will harbor this. So it is a silent disease until unless one were to participate in a screening or make an appointment with a physician and not wait for something catastrophic to happen. And we always believe prevention is better than cure, right? Be whichever aspect of the human body. But certainly when it comes to the heart, this is very valuable.
Yeah, I mean, heart health is some of the most important information you can get, especially when a lot of the things you just mentioned, like heart attacks, stroke, I mean, they can happen really at any time. If I could get personal for a minute, we just had a family friend pass away recently from a very sudden heart attack. So having events like this and having information available for the public is incredibly crucial. And Dr. Modi, are you seeing trends, either locally or nationally, that make events like this more necessary than ever?
Yes, the trend nationally as well as locally, when I'm on call, I'm surprised when I see young, I'm talking under the age of 40, walking with a heart attack, right? That is concerning. It makes us wonder what is happening in the community. And let's not forget the impact of these other habits, which may seem cool when folks are teenagers, right? And then those habits continue. I'm talking about smoking, I'm talking about perhaps increased alcohol use and marijuana and all these other things that happen. And the consumption of processed food leading to obesity, leading to diabetes. And all these things affect the metabolic health of the body, and then the stress on top of everything else doesn't help. So I think the biggest thing is seeing people, younger people presenting with heart. That is very concerning.
I mean, yeah, I mean, it is upsetting to hear about how people as young as, I think you said, under the age of 40 are having heart issues. I mean, yeah, it's something that needs to be taken care of everywhere you look. And that raises the next question. Who should consider attending this event, even if they feel healthy?
Again, excellent question. I would say certainly anybody over the age of 40 should come and see us or participate in any of the screening events whenever they're available in a community, because the younger ones always feel they're invincible. And these things, as I said, even hypertension, we call it as a silent killer. Just go get it checked. And by the way, one reading doesn't make somebody hypertensive, but at least if this one reading is elevated, it's a red flag. We will always tell you, go get another set of reading. If a random blood sugar is high, one set of reading is not going to diagnose someone with diabetes. We will encourage them to establish care with a primary care physician and get all these tests done. So anybody over the age of 40, somebody with a family history, somebody who has not ever seen a physician, they should just show up for these screening events. And I will also underscore the fact that anybody who has a known history of heart disease, they don't get well served by the screening event.
Lots of people, hopefully that we're going to be seeing a lot of people attend this event and getting this information. Dr. Modi, I got two more questions for you before we wrap things up. What long-term impact do you hope this event has on individuals and the broader greater West Bloomfield community?
As I mentioned, that truly is the mission and the ultimate goal of this screening event. Healthy individuals make healthy families and very productive, thriving communities. So health is imperative. And when we were talking about prevention, remember the cost of preventing a disease is so much lower than taking care of an individual who's now diagnosed to have heart failure, a heart that is functioning only at 50%. This adds a lot of burden to everybody around. So that walking away with this is not just catering to an individual, but we must realize that our community members make strong community.
That's absolutely right. Dr. Modi, where can people go to gain a little bit more information about this heart screening event and how they can get involved and how they can get some more information?
Yeah, so there is events like this is to spread the message. It's all over here in the hospital. And in general, as you had mentioned earlier on in the broadcast, everywhere, even if somebody's not at West Bloomfield, they're in a location, or their loved one is in a location other than West Bloomfield. If there is a Henry Ford Hospital nearby, they all are going to be offering this event. And it's a very simple process. Just walk in April 18th from 7 o'clock in the morning to 11. And remember, the very reason you're walking into these screening events is to change this notion of I feel fine, to walk away confidently that I know that I'm fine, right? That is the purpose of the screen.
And that's a great focus to have, to make sure everybody knows that they feel fine and they have all of the necessary information. Dr. Shalini Modi, thank you so much for joining us today here on The Splash Live.
Thank you.